Imagine walking into a children's hospital in Germany this winter. Every single bed is full. Doctors and nurses are rushing from room to room, overwhelmed. And worse, essential medicines are in short supply. This isn't a scene from a movie. It's the reality facing Germany's healthcare system right now. A massive wave of viral infections has pushed children's hospitals to their absolute breaking point. Clinics are overflowing, and at peak times some have no beds available at all. There's a worrying shortage of basic medications like antibiotics, painkillers, and fever reducers. Why? Because many are produced abroad to save money, sacrificing reliability for lower costs. The chairman of Germany's Hospital Association has warned that all areas of healthcare are being pushed to their limits. But how is this possible in a country that spends over €1 billion a day on healthcare, more than almost anywhere else in the world? While children's hospitals are in the spotlight, the entire system is under immense strain. A colossal staff shortage is one of the biggest issues. Major hospitals like the famous Karite in Berlin have had to cancel all scheduled surgeries, only performing emergency procedures. During the pandemic, thousands of nurses quit their jobs. The staff who remain are now facing unbearable workloads, especially with this winter's virus wave. But this crisis didn't just appear overnight. It's the straw that broke the camel's back. The real problem runs much deeper, and it boils down to one thing: money. About 20 years ago, Germany changed how it pays its hospitals. Before, they were paid for each day a patient stayed. This led to long, sometimes unnecessary hospital stays. To fix this, they introduced a system called DRGs, or diagnosis-related groups. Now, hospitals get a flat fee for each diagnosis, no matter how long or complicated the treatment is. This new system created a huge financial incentive to treat patients as quickly as possible, and to focus on profitable procedures like knee surgeries, while pushing aside less profitable but equally vital specialties. Pediatrics, the care of children, became a financial loser. It requires more time and resources, but the payment system doesn't account for that. Today, nearly 40% of German hospitals are run by private companies, and their primary goal is, you guessed it, profit. This has left doctors and nurses completely frustrated. Overtime is the norm, breaks are a luxury, and burnout is rampant. An alarming study shows that 1 in every 4 doctors in Germany is thinking about quitting. By 2035, projections suggest that over a third of all healthcare jobs could be vacant. Staff are tired of the bureaucracy, the lack of digitalization, low pay, and feeling unappreciated. Pediatric care is hit the hardest. Treating children simply takes more time, meaning doctors see fewer patients, but they aren't compensated for that extra effort or for being on call. In response to this escalating crisis, Germany's Health Minister Karl Lauterbach has announced what he calls a revolution in hospital care. His plan is to put medicine first, not economics. Payments per diagnosis will be reduced. Instead, hospitals will receive fixed funding to cover essential costs like staff and equipment. Hospitals will also be organized into 3 different tiers, from basic local clinics to highly specialized university hospitals. The goal is to reduce costly overnight stays by performing more procedures on an outpatient basis. For pediatrics specifically, a €300 million aid package is on the table. Of course, there are critics. Some worry these reforms won't be enough to solve the chronic staff shortages or fully undo the damage caused by the profit-driven system. But despite these concerns, almost everyone agrees that this is a desperately needed new start. The message is crystal clear: Germany's healthcare system has reached a tipping point. Meaningful reform is no longer optional, it's essential. By investing in staff, restructuring funding, and focusing on efficient but humane care, there is hope that hospitals can once again provide the high-quality care that all patients deserve, especially the youngest and most vulnerable among us. This winter's crisis is a wake-up call. It's a reminder to everyone: policymakers, medical professionals, and all of us, that healthcare is about people, not just numbers on a balance sheet. Putting medicine before economics isn't just an ideal. It's an urgent necessity. Thanks for watching. If you found this insightful, please consider subscribing for more deep dives into the issues shaping our world. See you next time.